Could you avoid common diseases with simple daily choices? Many illnesses we fear are largely preventable. This documentary guides you from why prevention matters to science-backed steps you can take today. We begin with stories. A mother who prevented diabetes through small diet changes, a teacher who avoided influenza by improving habits, and a retiree who preserved mobility by staying active. These real people show prevention is possible and practical. The problem is simple. Modern lifestyles increase risk. Sedentary behavior, processed foods, stress, and missed screenings push rates of heart disease, type 2 diabetes, some cancers, respiratory infections, and preventable injuries higher than they need to be. The science explains how. Chronic inflammation, insulin resistance, weakened immunity, and environmental exposures are underlying pathways linking lifestyle to disease. Research shows that targeted changes reduce risk significantly. For heart disease, lowering blood pressure and cholesterol through diet, movement, and medication when needed cuts risk dramatically. For type 2 diabetes, weight loss and regular activity improve insulin sensitivity. For many cancers, avoiding tobacco, limiting alcohol, protecting skin from sun, and attending screenings catch issues early. For respiratory infections, vaccination, hand hygiene, and avoiding crowded indoor spaces help. For injuries, strength training, balance work, and safe environments reduce falls and accidents. Now, practical steps you can start today. First, move more. Aim for at least 150 minutes of moderate activity weekly. Break long sitting periods and add strength twice a week. Simple walks, stair climbing, and gardening count. Second, choose whole foods. Prioritize vegetables, fruits, whole grains, lean proteins, and healthy fats. Reduce processed foods, sugary drinks, and excess salt. Third, protect your heart and metabolism. Maintain a healthy weight, monitor blood pressure and glucose, and follow medical advice about medications when necessary. Fourth, prioritize sleep and stress management. Aim for 7 to 9 hours nightly. Practice relaxation and cultivate social support. Poor sleep and chronic stress raise disease risk. Fifth, stay up to date with vaccines and screenings. Influenza, COVID boosters, HPV vaccine when appropriate, colon, cervical, and breast cancer screenings as recommended. Early detection saves lives. Sixth, reduce tobacco and excessive alcohol use. Quitting smoking is the single most impactful change for long-term health. Seek help and medications if needed. Seventh, protect your environment. Avoid excessive sun exposure, use safe cleaning products, and improve indoor ventilation to reduce infections. Eighth, build resilience through regular checkups and health literacy. Know your numbers, understand family history, and ask questions of your healthcare team. Small habits compound. The science is clear. Even modest weight loss, improved diet, and regular activity reduce the risk of type 2 diabetes by nearly half. Blood pressure control lowers stroke and heart attack risk, and vaccines cut severe infection risk dramatically. Prevention is not about perfection, it's about consistent, sustainable choices. Start with one change this week. Swap a sugary drink for water, add a 10-minute walk, book a screening, or schedule a sleep-friendly bedtime. Track progress and celebrate small wins. Community matters too. Support friends and family, advocate for safe public spaces, and push for policies that make healthy choices easier. Barriers exist. Food deserts, time pressure, and unequal access to care. Addressing these requires both personal action and societal change. Resources can help. Community health centers, online programs, peer groups, and evidence-based apps can support behavior change. Remember, prevention benefits quality of life now, not just future years. Fewer illnesses mean more energy, better mood, and preserved independence. As the mother in our story said, preventing disease felt like reclaiming control. The teacher described peace of mind from proactive steps. The retiree celebrated mobility and confidence. These are realistic outcomes for many of us. To recap, understand your risks, move more, eat whole foods, sleep well, get screened and vaccinated, avoid tobacco and excess alcohol, protect your environment, and seek support. Prevention is a journey, not a single moment. Make manageable choices, stay informed, and connect with your healthcare team. Every small change stacks up into meaningful protection. Take action today for a healthier tomorrow. Like, share, and subscribe for practical health tips and prevention guides.